So I thought I'd show you the two different visualization platforms we're using for managing our outreach for patients who potentially are affected by the fire. What you're seeing here is a program called ArcGIS. ArcGIS is a mapping platform in which you can ingest your data from your EMR and also overlay or underlay different layers that you can access publicly. What we've done here is we've identified our patients with their address and converted it to a latitude longitude and then uploaded it to our ArcGIS server, and that we then created a layer of patients on a map, and that is secured within the ArcGIS server at West County Health Centers. That is then published online and it's username and password protected, and the patient's information is only accessible by those with that username and password and resides on our server locally. And then what we did was we took the satellite images of the fire in Sonoma County, and we added a 1.5 mile radius for those satellite images, and that's what you're seeing here. You're seeing the pink outlay of those satellite images at a 1.5 mile radius. And then we drew in the actual wildfire activity that is also publicly available and updated daily. Those are the actual lines of the wildfire activity. And so what you're seeing here is ArcGIS has taken our patients. Each of these represents a patient, and these are now de-identified for this presentation. But if you click on it, you would see the patient's name, whatever other information you wanted to put in there, account number, address, phone number, and so forth. For this de-identified presentation, I just put information that would be like rendering provider, primary care facility, and you'll be able to click on that. And then ArcGIS, we were able to identify the area in which the patients and those map areas coincided, and so we colored those red. And so you're seeing that patients who lived within 1.5 miles of the active fire lines are red, and green is the other patients. Then we were actually able to take that data out and use it elsewhere for patients to make calls. What I thought I'd do is just show you some other interesting ways of using ArcGIS. Because of it, you can zoom in to those patients. Maybe you want to change the base map to another. Maybe we want to look more like at the streets. And what I did is for this presentation, because I didn't want to identify and make a mistake by doing that while I was showing this off, you can also pull a layer out if it gets to be a certain distance away. So it only allows me to go to a certain distance and won't let me go further. So you wouldn't be able to truly identify where those patients are. I also added, I thought knowing where the public schools are was interesting to identify those schools that may have been affected, and that would be a good outreach. That's Mark West Elementary, for instance, or San Miguel Elementary. Maybe that's an area that we might want to do some proactive outreach as a community health center. I added private schools as well. You can add specific IDs. We put, these are our health centers. I put our logo on there. I added my home. That's where I live. Thought that would be interesting for me to see where everybody else related to the fire. The grocery stores, so maybe we're looking at outreach for patient access. Maybe we want to put some sort of other food services there because there's a lack because of the fire. And then I was going to show just a way for you to look for other layers, healthcare facilities. Maybe we want to add in a layer that includes healthcare facilities, and you can see that that's actually broken down for you by hospital, medical center, federally qualified health center, home health, or a nursing home. So clicking on here, looking at grocery stores. There we go, Kaiser Foundation Hospital is there, and you identified that. So I thought this was a good example of being able to use patient data in a map and then using this for outreach. We have taken this information and created outreach call lists for our nursing staff and volunteers, and I have to say it's been overwhelmingly positively received, patients feeling very supported when we're calling them regarding the fire, any resources they may need, any support they may need, and we've done that because we're able to identify a smaller list. I wanted to also show the Tableau, a similar list. This is also de-identified. Same patient list. Actually, this patient list came from ArcGIS, and we then put it in Tableau. Tableau allows us to do some other drills and calculations, and so we identified those same things. Those patients are identified in the same area, and then you can drill those patients down into a list, and then download those lists into Excel for use of your patients or your staff. Tableau offers some different calculations that are easy to do, and you can overlay many other programs within it. So I thought I'd show that off as well. So if I wanted to download this list, that's where it would look. I wanted to go into security as well. Security at the Tableau level, all of this data is sitting on the KLH server that we have and is encrypted at rest and is the same level as we have our EMR data stored. Getting into this Tableau visualization requires a username and password. We can identify, for instance, we selected for this presentation, my username and password for Tableau automatically scrambled the account number, the patient's name, and any other identified information. The phone number is fake, for instance. Those are things that you can do at the back end so that if we had a specific username and password, we could set rights and an ability to interact with the data. For the ArcGIS, as I said, the data is also stored at rest, encrypted at the KLH servers, and is accessible at this layer only for people who have a username and password to get in. You can drop any other layers if we wanted to search for Sonoma Fire. There are many publicly available resources to add in, but if somebody was searching for this layer that we created, they would not be able to see that publicly, and also if for some reason they were able to see it, they'd have to have a username and password to upload it. So I thought this would help. This has been a very compelling use of this technology for us in the Sonoma during the Sonoma Fire, particularly as community health centers who are embedded in communities and been trusted over many years. For us to take the next step away from just retreating from the fire and start supporting patients, I really do feel like this is a great use of technology and community health skill set to support our patients. I hope that helps.